I want to do a short video here explaining to doctors how they really are able to help people to quit smoking. It's not going to be by the standard methodologies you've been given since you probably entered into the medical field, no matter when it was. The public health community, the tobacco control community, has never really given the information that physicians need to help people, their patients, to stop smoking successfully and to be able to stay off of smoking. There's a lot of physicians who are out there who just feel like quitting smoking is close to impossible. And there's a real good reason why, if you've been in practice for years or decades and been working with smokers, that you can believe this. One reason is, again, you're being told by most professional literature that it's really hard for people to quit smoking. It's almost impossible. That there really has to be extensive medical intervention of some kind to help people quit. And if you're on the front lines and delivering the help that you're being told is people's best chance of success, there's a good chance that if you follow up with patients who have been getting this help that you've been giving, that you're finding a very low success rate, that not many people are able to pull off quitting. And you read in the professional literature that not many people can quit smoking. You're seeing it in your own practice. So, common sense is going to make you believe like quitting smoking is close to impossible. Well, you need to understand something. We have more former smokers alive today than current smokers. Over half the people who used to smoke have stopped smoking. So working with the premise that it's close to impossible to quit when you have tens of millions of former smokers in the United States today, it's just something's wrong with the scenario, the belief that it's impossible to quit. It's not. But it is almost impossible to quit if you're following the approaches that, as a physician, you've been taught to disseminate to your patient population. If you listen to people who've quit smoking, you're going to find that the vast majority of those who successfully did it did not follow the kind of advice that you're being told to give to your patients. Now, there's a couple of points. I don't want to make this a long video. I'm going to try to attach resources into the video description that if you want more details and more concrete ways that you can personally work with a patient, you'll be able to get it out of those resource materials. What I want to deliver in this message here is the just bottom line fact that you really are going to be able to help your patients to quit smoking. You need to help them understand a couple of things. One is one that you're probably doing already, and you may be doing it very well already. How important it is for them to quit, especially if you have a patient who's got a medical condition that's caused by smoking. And you lay down the riot act to them of what they are doing to themselves and hitting home as best as you can and maybe as best as possible how important it is to quit. That is the first key component that you can do to help your patients quit smoking, to help them understand how important it is. But that's only half of a message. There's another half of a message you need to give them, and that's how to do it. And then hopefully giving them a plan that's going to be successful. And let me explain the importance of delivering both messages. If you deliver the message that it's really important to quit, their life is dependent on it, but you don't give them a solid technique on how to do it, they're not going to go, or they're going to try to quit, but they're going to use techniques which don't work, and they're going to fail. So all your message is going to have done is scared the life out of them and made them attempt to quit. They didn't know how to do it. They used an approach that wasn't going to work, and now they failed, and they have now solidified their belief that quitting is close to impossible for them. Or better than that, they're working with the belief that quitting is impossible. You made it clear to them they were going to die if they didn't smoke. They believed your message. They tried to quit. They failed. Well, the only, common sense reaction then, a relief from that kind of reaction is they can't quit smoking. Now, if you somehow deliver the message of how to quit and really give them a successful methodology to quit, and you don't give them the reason to quit, that also is likely going to fail. You've given them a reason to quit, but that reason that you gave them a technique to quit, but that technique's going to take a little bit of effort on their part, a little bit of commitment on their part. And if you didn't give them the first part, the part that really is going to solidify that commitment, well, they're not going to go through the trouble, and that attempt's going to fail. That's where, again, it's bringing in both messages, how important it is to quit and how to quit successfully. As far as how to quit successfully, it's totally different than what you've been told for years or for decades now while you've been in practice. You're being told that people, whatever they do, they shouldn't go cold turkey. And you're telling them that they need to set quit dates in advance so they can prep for quitting. And you're telling them that they have to use medical intervention of some sort. They need to use nicotine gums. They need to use patches. They need to use Zyban, or they need to use Chantix. It's all these things. I don't care what they are, but all of them that you're going to have been told and you're passing along the information, it's going to double their chance of success. If you go into your client population, if you go to your family and friends, if you go to your co-workers, physicians you know, people who used to smoke in your family, in your social circle, in your patient base, find the patients you know and the people you know who used to smoke, who don't smoke anymore, who've been off smoking for at least a year straight. And I'm going to clarify here, they've been off all nicotine for at least a year straight. They're no longer using quitting aids, and they are successfully not smoking anymore. Survey those people and find out how they quit smoking. And you're going to find the vast majority, if not all of them, are going to be people who are going to tell you they quit in one of three ways. They're going to have three scenarios in their background that initiated that quit and why the quit succeeded. And the scenarios you're going to hear, they were people who woke up one day, they were sick and tired of smoking, and they never touched one again. You're going to hear people who got sick. Nothing major. They had a cold or a flu. They felt miserable. They were down with an infection for 2 or 3 days. They couldn't smoke. They couldn't eat. They started to get better, and they realized, wow, I got 2 or 3 days under my belt. Let's see if I can keep it going. And they kept it going. Or you're going to find people who you told, you have to quit smoking. You've got something wrong. You're going to die if you don't quit. And they took your message, and they actually quit smoking. They pulled it off. Now, if you listen to those three scenarios, and again, you're going to find them repeated over and over again, the majority, if not all the time. If you listen to those three scenarios, they share two things in common. One is the technique that they used. They just cold turkey quit. And the other one is they didn't plan on it. People don't plan when they get sick. People don't plan to wake up sick and tired one day and of smoking and just don't do it anymore. People don't plan on going to the doctor to get the message that if they don't quit smoking, they're going to die. Your patients, if they think they're going to get that message, they often won't stick with the appointment. They don't plan these things. The way people quit smoking is they quit smoking. And yet what you have been taught to do, and what you very likely have been doing, is when a patient comes to you asking on how to quit smoking, one of the first things you're taught to do is tell them, whatever you do, don't go cold turkey. And if you're thinking about doing it now, well, don't do it now. Set a quit date. This is what you're being taught. You're being taught garbage information and passing it along to your patient base. People can quit smoking. You need to get that message out to the patients that it is fully possible for them to quit. You're going to need to understand they're going to be scared by the message. Hey, you may think you're able to scare them by telling them that smoking is crippling them and killing them, but so many of them have smoking so tight into their life that they believe that the day they stop smoking, their life is over, that they can't do all the things they did with cigarettes. So what you need to help them understand is that that's a false belief. They're working with the idea they're going to become nervous wrecks if they quit. They're going to be unproductive. They're not going to be able to get anything done. Their life will be over as soon as they don't smoke anymore. These are all predicated on the belief that cigarettes are doing all these wonderful things for them that they're not doing. Not only are cigarettes and nicotine not doing these things, they're causing the problems that they think that they're resolving. They think it's calming them down. It's not. Smokers are more nervous than people who don't smoke anymore. People who used to smoke and quit become calmer. Not the week they quit, but after they get over the initial quitting process, they overall will become calmer. They will become more productive. They will have more energy. People think, oh man, they're dragged out if they can't smoke. They're going to be just this dragged out, useless person for the rest of their life. They are working with all these false beliefs. And if you can try to get them to understand that these beliefs aren't real. There is a transition period when they're first quitting that might be awkward, but it's short. It doesn't take a long time to get through this withdrawal process. It peaks within 72 hours. It eases up after that. In a couple of weeks, there's no physical withdrawal whatsoever. There are still desires for cigarettes, but they're not physical, they're psychological, and there's things they can do to deal with them. The message I'm trying to get you to understand is it is possible for people to quit smoking. Don't pass along the idea like, I know you need to quit, but and I understand it's hard and you probably can't do it. No, the message you need to give them is they can quit smoking. They need to quit smoking. They can quit smoking, and there's a successful way to do it. And that way is by simply quitting smoking. It's not by transferring them onto other forms of nicotine, which are going to prolong their withdrawal process and basically undercut their ability to quit. In the video description here, I'm going to have a lot of resources for you to pass along to your patient, if nothing else. If you have the time, I would encourage you to go through the materials that you're going to show to your patients, that you're going to refer them to, so that you have an understanding. It'll help you answer any questions that they're going to come back to you with, and it'll make you more comfortable in being able to deliver the messages that they need to save their lives. And it can be done. And if nothing else I get across to you in this, even if you don't look at any of the material, if you can just understand that it is possible for people to quit. Anybody can quit. I don't care how long they smoked. I don't care how much they smoked. I don't care how addicted they say they are. Being addicted doesn't mean you can't quit. It just means you have to treat it as an addiction to quit. You treat an addiction like an addiction, people could control their addiction. If they try to treat their addiction like a bad habit, they will fail. And failing in this goal of stopping smoking can cost these people their health. It can cost your patients their lives. And you need to get them to understand that success is an option. They can quit smoking. And we have resources there that you can pass along to your patients to help them do it. The resources will cost them nothing. If you go through the material, it will cost you nothing but time. But it's worthwhile time for both your patients to go through it, especially for them. In a way, it's optional whether you go through it, but for them, the more information that they really get and understand on what they can do to pull off a quit, the better chance they're going to have of saving their life. And I hope you pass this material off to them. The main thing to understand with people who have quit smoking that you can do also as a physician is to keep reinforcing what they did. Every time they come in, ask them how they're doing, but not in a way like, oh, you don't believe they're not making anymore, but just say, how's it going? And, you're really proud that they did this. You're very happy that they did this, and help them understand what they need to keep it going. And this is another message that a lot of people aren't taught. In fact, they're taught the opposite. They're taught like, oh, slipping is common. Don't worry if you slip. One message that you need to get across to all your patients who are thinking about quitting, and equally important, maybe even more so, those who have quit already, is to understand that they are dealing with an addiction. They're asymptomatic now because they've been off smoking. But if they administer the drug again, they're going down the path of usage again. They're going down the path of active addiction again. What they need to understand to stay off of smoking, the relapse prevention strategy that's guaranteed to work 100%, that if they don't want to be a smoker again, they need to understand, and this is the message that hopefully you'll get across to them, that for them to stay free forever, they need to stick to a personal commitment to never take another puff.